Ear infection is an infection at any part of the ear. Our ears are divided into three parts really. One part is the external ear, the other is the middle ear, which is involving the eardrum, and then the inner ear, which is a part of called as the cochlea and the semicircular canals. So the infection can happen in any part of the ear, and the symptoms and the management is different in these different parts, but none of these infections are contagious. Most common sign would be pain in the region of the ear. It could be out in the outer part of the ear. There may be some swelling also in the ear. Sometimes they come with a complaint that some watery fluid or some pus is coming out of the ears. Another common complaint is that they feel blocked in their ears, they cannot hear properly. Some of them say that they have fever, cold, cough. Some of them even have complaints of giddiness. Then, in the extreme situations, they may have headaches, they may have vomiting. But those are very extreme situations when the ear infection is not treated. The common ear infections that occur in the outer part of the ear are because sometimes somebody puts a earbud in their ear, or they may scratch their ears with their hands, which have a lot of infection and bacteria. Then they may get a boil, or they may get some kind of a ear infection in the outer part of the ear. These infections are very painful, but they can be treated easily, and they will get resolved fast. Then there is a part of the ear infection which is involving the eardrum and the middle ear. Commonly, these infections happen because of a cold or a cough that they have had earlier, and it is not treated properly, and then that infection goes into the ear. These people have symptoms of ear pain along with ear discharge. They cannot hear, and then there is a problem with the inner ear, and these people will have uh, symptoms of giddiness and not being able to hear properly, vomiting. So these are the symptoms of the ear problem. Our ears are very close to the brain. In fact, they are separated from the brain by a thin layer of bone, which is a part of our skull bone. So, if ear infections are left untreated, sometimes that the bone starts getting infected and eroded, and then the ear infection can go into our brain, and we can get serious brain infections like meningitis. You can even get an abscess in your brain. So it is very important that you treat it as soon as you come to know. Otherwise, over a period of time, you can get much more severe complications. The another part about the ear is that the nerve which supplies our face is called as the facial nerve. It is responsible for the movements of our face and also the movements of our eyes. This nerve passes through the ear. So if we do not treat our ear infections in time, then we can get what we call as a paralysis of that facial nerve. Then there will be other complications. So we need to treat our ear infections quickly. Outer ear infections, there is no hearing loss, but sometimes with middle ear and inner ear infections, one will get a hearing loss. This hearing loss can be treated with medicines if it is caught in the initial stages, but if you neglect it and the eardrum gets affected or the bone around the ear gets affected, then treating it is little difficult. The common medical treatment for these patients is that we give a course of antibiotics along with some painkillers and some cold medicine and ear drops. Typically, with that, the ear infections, if it has happened for the first time, then it gets resolved. There are some people who have neglected their ear problems and they've gone on for years together, then those people have to be operated to get their hearing back, to clear all the infections in the ear. Infections can be very easily prevented one of the commonest things many people do, or many people come to us with, is asking us, how do we clean our ears? Should we be using a earbud or not? So the answer to that is absolutely no. One should never use a earbud to clean our ears. Our ears are self-cleansing and they do not need any clean. If there is any pain or discharge, you can go to the ear doctor. Another thing is that you've had a cold which is not going away in 2 3 days. You've taken some over-the-counter medicines or your family doctor's medicines, and the cold is not settling down. You're starting to feel blocked in your ears, then immediately go to the doctor and get your ears treated.